name's Adam, and this is Natalie.
Hi.
And today we're talking about how we can use Dr. K Kinesiology Tape to help with edema or swelling management. In this particular circumstance, we're going to choose a quadriceps corky on her right thigh. So we've pre-cut some pieces of K-tape into strips that have separate sections, and we're going to apply these in a bit of a crisscross pattern over the point of injury. So to prepare the tail of the tape for application, we're going to fold down and then make a little tear along that line, and then we can fold back a piece of the paper as a handhold and then peel off to allow for our starting point application. So I'm going to let Natalie take over from here. So we're going to place the base piece of the tape on the outside of the thigh as she's doing. Stick that piece down, remove the underneath piece and apply without any tension just along that little section. And then we're going to do the same thing with our other piece. So we're going to fold down, tear along the line. So we're trying to avoid touching the tape because it's going to affect the properties of the adhesive. And peel off that section. And then we're going to try and align that in a bit of a cross pattern. So we're going to aim for the centre of the cross to be over where the corky is. So we're going to go back a little bit further there so we can allow for a little bit of stretch. Stick that down, peel off. And then we're ready to apply our multiple tail pieces. So we can just do one at a time. So it doesn't matter whether you start from the top or the bottom, whatever you feel comfortable doing. And we're going to grab our little piece of tape, peel it back most of the way, hold on to the last little bit of it, and we're looking for around about 25% tension. So you can pull all the way to get 100%, come back halfway, and then stick down along that line. And then we're going to repeat that, and we're going to try and create a little fan shape with the tape so it covers the cross-sectional area of the injured site. That's it. And then we'll do the last one. Trying to leave the last portion of the tail without any tension on it to allow the tape to just draw back a little to decompress the tissue. Good. And then we're going to repeat the same with the taping on the other side. That's it. And we're going to fan across that area of point where we're looking to try and unload the tape. That's it. Last one. So the idea being that the cross-section pattern over that tape is going to allow for better circulation and removal of bleeding fluid from the area while still supporting movement and normal function as best as possible. So tips for keeping the tape on: we want to make sure that the skin's nice and clean before preparation, so avoiding things like moisturizers, lotions, those sorts of things, as well as trying to avoid catching on clothing. So when you're getting dressed, make sure the tape doesn't peel up. Sometimes it helps to cover it with something compression oriented, like a piece of tubular grip or tubular bandage. In addition to that, we're dealing with a new injury situation, which has usually just happened in a sporting context. So we want to try and address it with the normal management strategies we would use for that purpose, like our rest, ice, compression, elevation in that first 48 hours. After that period of time's elapsed, then we can seek care to use supplementary treatments like massage or heat or anti-inflammatory management for progressing injury rehabilitation. So for more information about kinesiology taping or Dr. K tape, please contact sportstrap.com.au.